Greetings, everyone. Thank you for being with us. Let's go ahead and call the meeting to order, and we're going to forego the flag salute since we're not in the presence of a flag or the presence of one another. Let's take roll call. That might be a good way for us to establish who's on and who's not. So, Jeff, could you do roll call for us?
Yes, thank you, sir. Dr. Lyon.
Here.
I see you. Dr. Kansen.
Here.
Thank you. Chris Miller.
Here.
Okay. Sheriff Youngblood. Sheriff Youngblood, to unmute, press *6, Sheriff. And I believe if you're on a computer, you should be able to either just unmute yourself or hit *6 as well. Okay, Orator Crier. Leslie Wilmer.
Here.
John Surface.
Here.
Supervisor Maggard is here.
Here.
And Bruce Peters.
Here.
That's 7. We do have a quorum.
Thank you very much, Mr. Ferris. So welcome, everybody. Are there any participants on the call that we don't know who they are? I don't mind if the public's here, but I just want to know if there's any media that's on our call somewhere.
I do not know. We've got a couple of phone numbers that are on here that are not registering with names.
Okay, it's a public meeting, so anybody can be in the meeting. I just like to know if there's media or not there. So, okay, everybody, thank you for joining us and for your being in attendance. Our item number 4 on our agenda today is our consent agenda. Consent items are indicated by a CA for each item. They would be item number 5, and then go down to item number 10, items A through G. Item 10H is not on consent, but items A through G would be. And Mr. Ferris, I believe that's all the items on consent for today. Is that correct?
That is correct.
Okay, does anybody have any questions about an item on consent? Not hearing anyone, I'll proceed then. Are there any members of the public in attendance today that would like to make a comment about an item on consent? Not hearing anyone, then I would entertain a motion to approve the items on consent, please.
I'll make a motion.
I'm sorry, each time anybody speaks, can you tell us who you are first?
Miller, Chris Miller.
Thank you, Chris.
Chris Lyon, I'll second.
Very good. Motion is second. We're going to do a roll call vote because we can make sure we know all the participants that way. So, Mr. Ferris, can you go ahead and conduct the roll call vote for the consent agenda?
Yes, sir. Thank you. So, Dr. Lyon, you seconded. Okay. And yeah. Dr. Kansen?
Aye.
Okay. Chris Miller brought the motion. Sheriff Youngblood's not on the call. Leslie Wilmer?
Yes.
John Surface?
Yes.
Supervisor Maggard?
Yes.
Bruce Peters?
Yes.
The motion passes, all ayes.
Very good. Thank you, Mr. Ferris. Next is item number 5 was covered under consent. So item number 6 is subcommittee reports. And Mr. Ferris, my notes indicate that there are no subcommittee reports to be heard today. Is that correct?
That is correct, sir.
Thank you. Next is item number 7, public comments. Are there any members of the public that have sent in emails, notes, left messages? Let's do that first, that wished to have their comments read in the record. Is there anybody like that, Mr. Ferris?
No, sir.
And are there any members of the public that may be in the queue online with us that would like to make a public comment about any matter that's not otherwise on our agenda?
Not that I'm aware of, no.
Let's give just a moment to see if any callers are, I'll give just a moment for that. Any callers want to identify themselves to make a comment or public comment? Hearing none, then we'll conclude the public. I'm sorry, did somebody say something?
I have Orchel on the line, and he's wanting to make a comment. I have him on speakerphone, so I'm going to go ahead and let him speak.
Okay.
Go ahead.
Yeah, I have my hand up, but let's wait it again. Waiting. But anyway, I have, maybe for me, might be a future agenda request, but not on the agenda is that I have Jerry Starr from Westside Healthcare District was asking me about the like a portable CPR machine for the ambulances and stuff. He's wondering because of being far away and the distance and stuff, so having a heart attack or whatever, facilitate saving more lives if the ambulances in faraway districts can have those in their ambulances. That'd be possible.
Mr. Ferris, do you know what he's talking about? And is that related to the matter for which we have a hearing today, or is that a separate matter?
I believe he's referring to the item that is on the agenda for discussion today regarding a hearing.
Okay, I must have missed it because I just got on. I've been trying for about an hour trying to get through, but anyway, I did not hear that. So, thank you.
Okay, Mr. Fryer, we'll come back to the public hearing issue in just a little bit, okay?
Thank you.
Okay, thank you. That concludes public comments then. Item number 8 is public requests. Do I understand correctly, Mr. Ferris, there are no requests from the public to make presentations today?
That is correct.
Thank you. Next is item number 9 under unfinished business. It's the ambulance patient offload time report to the board. This was requested, I believe, in the February meeting, and Mr. Ferris has an update about kind of some where we are with it and a strategy that has been tested to see if it might provide some positive results. So, Mr. Ferris, can you go ahead and give us that report?
Yes, thank you, Mr. Chairman. On February 13th, MCAB requested that EMS staff conduct a deep dive into the issues of the ambulance patient offload times. We began to look into the issue by reaching out to the hospitals, trying to determine the root causes of the issues. The information we obtained appears to point to multiple different issues. Call volumes are one, hospital staffing, and throughput is one of the main causes. That is, how quickly can a hospital get a patient in the door, treated, and back out the door again. With that said, on March 17th, the Public Health DOC was officially activated for COVID-19, and all of our energies and focus had to be shifted to COVID-19. So we did not have time to continue that deep dive. However, I do want to add to this comment that recently I've been working with Hall Ambulance Service and even worked with Dr. Lyon, and we reached up to the state, and we have worked on a collaborative agreement at this point where the ambulance provider can send a crew to an ER that is heavily impacted and delaying the offload of patients, and they can take multiple empty gurneys with them. And as ambulances come in and continue to roll in, if necessary, they can offload that patient to the paramedic who is in the ED, and that paramedic can then watch that patient while the crew can go back out into the field and run calls. We did run a test of this last weekend. Hall sent a supervisor to a specific hospital with an EMT, and on Friday, they were able to relieve 6 ambulances so that they could return to the field, and on Saturday, another 6 ambulances. So that's a total of 12 ambulances and lots of hours that are back out on the street and able to run 911 calls that weren't prior to that. So right now, I'm in the process of writing a policy countywide that will allow ambulance providers to do that very thing, to allow, it's a stopgap. It is not the solution to the problem by any means, but it is a stopgap, and it allows crews to be able to turn around and get back out in the field, which is assisting the ambulance provider with their response times and getting to those patients who truly need them. So with that said, that concludes my report. We have not been able to get much more deep into this subject because of our focus on COVID. So I'm requesting that we extend this project at least through November, possibly into spring of next year, when we will have more, hopefully, opportunity, more staff time to develop into this project.
Thank you, Mr. Ferris, and it's understandable that we're all dealing with a crisis at the same time, so that's understandable. I believe this request was made by Mr. Surface, and would you like to comment first about his explanation and what you think of this demonstration, this test that we tried?
Sure, Mr. Chairman, thanks. So we did try it at one hospital, the hospital that tends to create the longest and most frequent offload delays. It still puts the burden of the problem on us to solve. It doesn't fix the problem in any way, shape, or form. We have sent literally hundreds of emails reporting the offload delays to the department over the years, more so the last 2 years. And so it's a stopgap. I mean, it gave a little bit of relief to us, but it's still on us to manage the hospital's problem. It's still the cost, the burden is on us. We lose a supervisor for 12 hours. We picked what we think is the time of day. Well, we know it's a time. We can look and see what hours of the day we are most likely to have an offload delay. And we've deployed a full-time supervisor and his partner over there to that one hospital. We did make arrangements with one other hospital to store equipment in case that hospital becomes an issue again. And we're waiting on another hospital that has high volume, and when they have offload delays, it's extreme as well. Due to a leadership change, we haven't got an answer yet. So we're hopeful. I talked to somebody this morning trying to move that along a little bit. But again, this still puts the burden on us to solve the problem. And I know because of the situation that we find our country in, we have to be a little patient with reports. I certainly am more than willing. Hall Ambulance will dedicate whatever resources we have to help complete adequate research on the problem. But we've been talking about it for years. Since way before Supervisor Maggard was even on the Board of Supervisors. That's how old this problem is, right? You probably heard about it when you were with the City Council. So, we continue, the way we look at it, we're being damaged in many days by the offload delays. And we had another problem with the delays where they're actually asking us to wait outside. We addressed that. That hasn't happened. One of the CEOs stepped up and said, call me personally if that happens, and I'll fix it. I called him, and he fixed it. And so the word is out not to do that anymore. But this is a serious problem, and all we're doing right now is temporarily giving a little bit of relief. And I will tell you, though, 6 units is still a lot. I don't disagree. You put 6 more units out on the road, that's 6 more units to run calls. And while I appreciate that, it's still 100% of the burden to solve the problem is on us right now. Mm-hmm. And that's all.
Thank you, Mr. Surface. I have the same concern. The cost of the staff that is providing this workaround is being borne by the ambulance provider. It's my understanding that the patient becomes the responsibility of the hospital when the ambulance rolls onto the hospital's property. I might misunderstand that, and I'm not trying to wade into a big controversy here. But I think an issue for us to task Mr. Ferris with is discussing what alternatives there are so that, should that cost be borne by the hospital, or what is the long-term solution to this? We've all got our hands full at the moment, but I do hope that's something that can be fixed. But without me going on about that, are there others that have comment about the report that we've just heard? And if you want to speak, let me just make sure we make this clear. Mr. Ferris, is it set up so that if they want to speak, they can indicate that in the message box, and you know who's in the queue to speak next?
They can press *6 and unmute themselves, sir.
Oh, so you don't need them to announce that they want to speak?
No.
Okay, so who else would like to speak about that? Please just tell us who you are first, and then that'll help us focus on who's on the screen with us.
Yeah, this is Bruce. I'd like to speak to that if I could.
Hi, Bruce.
Yeah, I've worked with John with this for years, as he suggests, and it's true. We do struggle. We work very hard to try and unload as best we can. There are a lot of factors that create this issue. And there are probably multi-factors involved with solving the issue, all the way from we got to get more nurses in Kern County to we've got to stop transporting everybody who thinks they have a hangnail. I mean, we need to be more aggressive about who needs to be transported and who doesn't, because all it does is to serve to clog up our ERs. I know that John has addressed that during this COVID pandemic, they've seen record volume, and that is definitely an issue. The people that are being transported now are really, really sick, much more so than they have in the past. I think we may be seeing a little bit of a shift in community behavior, that when we come out on the other end of this, it might look a little different. But right now, I think there are another bunch of other factors that are involved with the record volumes that they're seeing, with people delaying care, getting into trouble. So the acuity of the patients that we're seeing right now is much higher. We have spent the last several months begging for more help. We've used every agency at our disposal. The supervisors thankfully approved the CARES Act money to be used to fund ICU nurses, which is one of our most critical shortages. But the fact remains is all hospitals are struggling to have staffing to meet the needs of the community. So while I'd like to be able to say it's a simple fix, it is not. It has never been. And I do sympathize with John and his team's struggles with that. I personally work very hard to make sure that we do the best job we can. But I do not have all the answers, but I am certainly willing to work on it with everyone involved.
Thank you, Mr. Peters. Anybody else want to say anything?
Chairman Maggard, could I follow up, please?
Yes.
I will tell you that one of the things that Bruce mentioned, we have a list that we create every day about frequent users, and we have one person in Kern County that's already called 101 times this year. We have another person that's been transported 56 times, 49, 45, 43, 43, 42, 41, 40, and on and on. And that is something that we got to fix that at some point, right? And one of those people on that list that I just discussed is a former employee of ours, and the county followed their protocol, and they gave her notice that she's not getting an ambulance anymore. They're not going to. She can't keep doing this, and that's rough on her. Another stat that Bruce is talking about, acuity. Our cardiac arrests have doubled over 2019. since COVID started, where we're normally seeing 40 or 50 a month. We're now seeing 100 a month. These are cardiac arrests in the field. So the acuity of the people that we're seeing has changed, and I don't know whether Dr. Lyon has done any research into that yet or not. But certainly there's a change in the people we're taking to the hospital, without a doubt. It's not just people that have fallen and broken a toe, but there's some really sick people heading into the ER right now. And the last thing that I forgot to mention earlier, a few weeks ago when we had 3 or 4 days in a row of record volume, and our people were so worked to the bone and so stressed out, we actually had to reach out to Matt Constantine, the public health director, and ask for help. And he brought in 2 strike teams from out of town for a weekend, 2 ambulance strike teams. Hard for us to do, to say we can't handle it. 10 ambulances came to town. They were deployed into the system and gave our folks a little bit of a break for those 3 days that they were here. Well, yesterday's call volume was right back where the days right before we asked for strike teams, right? So it is it's crazy, the call volume and the acuity of these folks, but I do think that I want to make sure that Matt and the department get credit for I think it was about a 9:00 a.m. phone call, and by 3 in the afternoon we confirmed that help was going to come down for the weekend to give our folks a break. And this COVID thing, I know I'm getting off slightly, but we've actually hired a full-time mental health worker, right, to help our staff as they're running these calls after call after call and waiting at the hospital and the COVID. And if you put on PPE right now and go out on a COVID call, and we've run over 1,800 COVID calls now, you put full PPE on and go from somebody's house out to the ambulance when it's 105, and you're wiped out. So there's a lot going on in the system right now. I don't think that our healthcare system, Bruce can probably speak about this better than I can, but our hospitals have been full, and they've been full of really sick people. Anyhow, thank you let me give a follow-up.
Yeah, thank you. Do we have either of our fire chiefs on this call?
I do not believe so, sir.
Okay, thank you. I'm no expert on fire departments, but I believe we have a similar ripple effect in our fire department. Every time 911 is called and an ambulance is sent, so is a fire truck. And that fire truck takes somebody off station. And we have the same issue that the ambulance provider has, that we all have, is that we have employees who are becoming ill. As we wait for test results, we have crews of firefighters that are not able to be there. So there are compounding problems that are when fire trucks chase these same calls that end up not being necessary. So, this has been kicked around a long time. On our watch, this group that's assembled here, it'd be nice if we could solve this. So I'd like to stay just a moment longer and hear from us, those participants on this call. How do we get to the solution? Is there, who do we need to put in the room together to try to come up with a solution? Is that the hospital administrators? Is it a subset of that? Is it could we appoint a task force that their job becomes what are the issues and how do we solve them? What are your guys' thoughts to that?
Well, this is Bruce again. I sympathize with John in that I think there should be a little more pressure on the hospitals to solve this issue, and I think it takes a concerted effort by a CEO in each of the hospitals. I think I can only speak for Mercy, but I work hard with John and my team to support, and I think that shows up in the statistics. But I do think that there needs to be a little more concerted effort from the hospitals. That being said, there are structural issues in healthcare that it cannot be fixed overnight that also create this issue. The shortages of healthcare workers in Kern County is severe. And I've been begging Matt and public health for help for the last several weeks. We were getting some of it. We need to have our people get a break just as much as John's do, and we're getting some help, thankfully, and I appreciate that work from Matt and Jeff in particular. But some of this is structural, Mr. Chairman, that even us all getting into a room is something that the state of California and Kern County in particular are going to struggle to solve. So we may get to a place where we can do better, and will that be enough? No, but it'll be a start. So, I think we can work through the hospital council, which I'm a part of, to renew this effort.
Yeah, Bruce, I hope you don't take my comments. I'm not being critical of you. You are a problem solver, not a problem deferrer. So don't think I'm being callous towards you. I'm grateful for your help.
No, I don't.
Okay, good. Thank you. So Jeff, do you think when you come back to us, is it November? November's our next meeting, right? That's a long time. How does the committee feel, the MCAB board feel, about if we were to find a solution and start to convene somebody from the ambulance providers, somebody from the fire department, somebody from the various departments, somebody from hospital administrators? Is the board uncomfortable if we begin to try to work on solutions without having to reconvene and approve that structure? Are you guys okay if we just kind of work at that and see what we can come up with, and then we'll incorporate it into the report back? Anybody have concerns to not do that? I don't hear any concerns. So, okay, so Jeff, why don't you and I brainstorm some about, Mr. Ferris, about who we might convene. And we have discovered, I'm not doing this to pat ourselves on the back, I just want to share with you, in Kern County, all of us at this table today, throughout Kern County, this is the way it is. We find solutions, and we have, like the ICU nurses, there's no other county in California doing what we're doing. We're trying to do the same thing with reagents so we can make testing occur faster. We have a record of finding solutions here. So maybe we could identify those things that are state issues and then turn up the heat on state bodies to fix what needs to be fixed at the state level. But Mr. Ferris, are you comfortable, willing to work with me on convening some kind of group to do that?
Absolutely.
Okay. Thank you. Is there any other discussion about item number 9, the ambulance patient offload time report?
Mr. Chairman, this is GK, your county counsel. I think just for the record, I know you asked, was there any opposition, but maybe you want to ask it the other way so you have some level of formality of going forward. That'd be my recommendation.
You mean that we have a motion that allows us to establish a task force?
I think that would be good, so there's some clarity for the record and among the board as to what's going to take place, if that's your intention.
Okay, so thank you. So I'd like to ask the board if somebody would make a motion that we begin the process of identifying and establishing a task force to be made up of representatives from the community to deal with identifying what these issues are and try to find some solutions. Would somebody make a motion that establishes that?
This is Leslie.
So I think Leslie said a motion, and I think Dr. Lyon said a second. Is that good enough?
Fair enough.
Thank you. So for that purpose, I told you before, Mr. Ferris, we do it by roll call, but maybe this is easy enough just to say, all those in favor of that, please say aye.
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 Is anybody opposed to that? I don't hear any opposition. Is anybody opposed to that? Okay, very good. Thank you all for that. We'll see what we can do about that. Next is new business, item number 10 on our agenda, and items A through G were covered under consent, but item number H, the request for a hearing, as it's identified here, is not on consent. So, Mr. Ferris, why don't you tell us what this is about, and then we'll begin this discussion.
Thank you, Mr. Chairman. On July 20th, 2020, Hall Ambulance Service requested MCAB hear an appeal of a decision made by the EMS Program Medical Director to withdraw the use of a specific piece of equipment from the field. Attached in your packet, I gave you the bylaws that list a specific appeal process. And at this point, I'm going to hand it over to GK to pick up where I left off.
Thank you, Jeff. To the MCAB board, Mr. Chairman, just by way of background, the Health and Safety Code provides that MCAB shall act in an advisory capacity to the county board or board of supervisors which it serves and to the local EMS agency on all matters relating to emergency medical services as directed by the board of supervisors. So that's your mandate. In our office, in reviewing the legislative history of Kern's MCAB and the 1987 minute order that established it, the board determined that MCAB's duties are included but not limited to establishing and conducting an appeals process to examine and decide grievances related to both administrative and consumer issues. It should be noted for your board that neither administrative nor consumer issues is defined in either the bylaws or in the minutes. The requested appeal by Hall Ambulance of the use of AutoPulse is arguably an administrative issue or a consumer issue, and therefore appears to council to be a proper subject for appeal. Allowing the appeal to MCAB is also consistent with the Board of Supervisors' stated intent in establishing MCAB that it be a strong advisory committee to provide continuing review and recommendation concerning EMS policies and programs. As Jeff mentioned, the appeal process is set forth in Section 11 of the MCAB bylaws, and you can find it at page 202 of your agenda package. This appeal process is relatively procedurally robust, and given my understanding of the length of the presentations by both sides, and given that as a Brown Act board this would require appropriate notice and time to conduct the hearing and permit public comment, it is a recommendation of council that if your board determines at this meeting that an appeal should go forward, that instruction be provided to staff to work with Hall Ambulance to establish a mutually agreeable date and time for the hearing. The venue, given COVID-19 exceptions to the Brown Act, is permitted to be virtual. Finally, should your board decide to grant the request for an appeal hearing, the bylaws state your role. Specifically, the MCAB members' role is to listen to the testimony and review the evidence presented by the parties in an appeal and to ultimately decide on a recommended outcome of the case. The bylaws also state in Section 1H, the final decision of MCAB shall be in the form of a recommendation to the EMS division for resolution of the appeal. The final decision still resides with EMS and its medical director. So that is my summation, and I'm available for questions, Mr. Chairman, if there are any.
Thank you, GK. I appreciate that explanation. So we have a request to conduct a hearing wherein a decision made by Dr. Lyon could be appealed to us. The process is, I just want to restate this so it's clear to everybody. The process, as I understand it, then would be if we conduct that hearing, that we receive testimony and documentation, and then we would reach some kind of a conclusion and recommend something to Dr. Lyon, but it should be crystal clear to everyone. At the end of this process, Dr. Lyon is the one who makes this decision. That's his responsibility, and he's vested with that authority. But we can provide a forum in which the facts and circumstances can be laid out for discussion and just for review one more time. I'm comfortable doing that, but I want everybody to understand the nature of the process is that eventually it goes back to Dr. Lyon, and Dr. Lyon, confirms or changes his decision. That's his call, not our call. The process would likely require us, I'm not certain, but it would likely require us to go into closed session. Some of you have never been in closed session before. You don't know what that is. But GK can explain this in more depth than I can, but there are very strict levels of confidentiality, who can be involved in reviewing these documents and reports that we would see, and we are bound to keep confidential the things that we would hear in closed session amongst us, and then our report doesn't reveal those items. It just reveals a recommendation to Dr. Lyon. So GK has explained it. I've explained it a little bit. Do any of you have any questions about whether or not you think we should proceed with scheduling a time to conduct such a hearing? Is anyone willing then to make a motion that we conduct a hearing, or that you just since nobody commented, is the consensus of the group that you'd rather make a motion that we do not conduct the hearing? But I'll entertain a motion in either direction.
This is Bruce. I make a motion to conduct the hearing.
Thank you, Mr. Peters. Is there a second?
This is Chris Miller, and I make a second.
Thank you, Mr. Miller. Any other discussion about that?
Supervisor Maggard, this is Dr. Lyon. I will abstain from the vote.
Thank you. That's important for us to distinguish. Dr. Lyon is the one who arbitrates at the end. He decides what the answer is. So although he might provide us information, he won't participate. As I understand it, Dr. Lyon and GK, you won't participate in the voting of what the recommendation is. Is that correct?
I'm sorry, Mr. Supervisor Maggard, I didn't catch your question.
Oh, I just want to confirm that Dr. Lyon is recusing himself from this vote because he eventually will have to make a decision based upon our recommendation. That doesn't mean he can't be part of giving us information, but he's not going to participate in the vote for that reason. Is that correct?
That's correct, and I think Council's recommendation that Mr. Surface would not participate in this vote either.
Okay.
Yeah, I would agree with that.
He's an interested party.
Yeah, we've already established that with the association. Aaron Moses, the alternate, will participate.
Okay. Okay, so are there any other questions? Thank you for your statement, Dr. Lyon and Mr. Surface and GK. Any other discussion about this? Then why don't we go ahead and take a roll call vote on that? That will help us with when you read certain names, they can declare their abstention if that's what they need to do. So, Mr. Ferris, could you go ahead and take a roll call vote on this issue? Then we'll come back and talk about a date in a moment.
Yes, sir. Thank you, Mr. Chairman. Dr. Kansen.
Yes.
Chris Miller.
Yes.
Leslie Wilmer.
Yes.
Supervisor Maggard.
Yes.
Bruce Peters.
Yes.
I believe that's everybody who can vote, and so it would be passed with all ayes.
Okay, GK, do we need to put on the record that Dr. Lyon and Mr. Surface abstained? You're on mute, GK.
I hit it twice. Sorry about that. Yes, that's an important part of the record, Mr. Supervisor.
Yes. Thank you. So the record will reflect that Dr. Lyon and John Surface both abstained from that vote. So thank you for that. Mr. Ferris, I think the next matter regarding this issue is choosing a date on which to conduct this. You think this might take some time, as I understand it, and you suggested that we start at something like 10 o'clock in the morning. You suggested 4 dates. Do all the members of the committee, Mr. Ferris, did all the members of the committee receive those suggested 4 dates?
Yes, they did. It was in their packet.
Okay. So September the 7th is Labor Day. I don't know about you, but I don't want to do this on Labor Day. The other days are September the 9th, then September the 17th, or September the 18th. September the 17th is a Thursday. The 18th is a Friday. I suggest to the group that Thursday, September 17th at 10 a.m. might be a good time for us to convene this. How does that set with all of you? Can that work, or do we need to give you some time to look?
This is Bruce. It works for me.
This is Earl Kansen. It works just fine.
Thank you. Anybody have a problem with that?
This is Chris. It works for me.
Just wanted to confirm that this would conflict with the QI day, but considering the COVID situation, I'm assuming we will replace the QI day with this meeting.
That's correct. We will reschedule the QI meeting if this is the date that you all choose.
I don't know what the QI meeting is. Are we disturbing someone by doing that?
No, not at all. It's not a problem.
Okay. Okay, so do we have a consensus that Thursday, September 17th, 10 a.m. will be a good time to conduct the hearing? Okay, and and GK, if it requires us going to closed session during that, can it be noticed so that the closed session can be conducted on that day? So we, at the end of that, can go back into public session and make a recommendation if we have one?
Yes, and I think to your question, Mr. Chairman, I'm sorry you're hearing some ambulance noises outside of my window. It is likely that part of the hearing may have to be held in closed session, and then some of it may be in open session. And we can advise both the board and staff as to the legal requirements for that hearing.
Very good. Okay, thank you, GK. John, tell your people to keep it down, will you?
Yeah.
Okay. Okay, so I think, Mr. Ferris, does that conclude the actions necessary for us to take with regard to item 10H?
Yes, sir, I believe so.
Okay, thank you. Next is item number 11, the manager's report. Mr. Ferris?
Thank you, Mr. Chairman. Basically, I just want to hit a few bullet points this time. I'm not going to sit and berate you all like I have in the past with very lengthy reports here. I just want to go over and let you all know some of the things we've been doing since COVID-19 hit. As I mentioned earlier, on March 17th, Public Health DOC activated, and that basically shut down all normal focus for us, and we had to shift our attention to COVID-19. Since that time, we have managed and expanded an existing warehouse for PPE. We have distributed over 1,860,000 pieces of PPE since COVID struck, and over 1 million ounces of hand sanitizer. We have barrels of hand sanitizer. We've managed and monitored skilled nursing facilities, including bringing a CalMat team from the state to assist with Kingston and facilitate a team from Liberty Ambulance to provide staffing for Valley Convalescent during a time when they had lost numerous staff. We've provided tens of thousands of testing swabs and transport medium to hospitals, testing sites, skilled nursing facilities, and urgent cares. Managed and ordered and distributed thousands of doses of remdesivir. We created an alternative care site and filled it with supplies, and it is currently standing at ready in the event that we have a massive surge of patients and we need room to expand. We've developed numerous policies and procedures that were designed to help field crews and hospitals during this time. Using the MOOC program, we've worked with the state, brought in multiple strike teams of EMTs, paramedics, nurses, doctors, respiratory therapists to assist the ambulance providers and hospital providers. Right now, as we speak, there are numerous hospitals in this county that have state-provided personnel providing assistance. We have been working 24/7, literally sometimes, to protect our citizens since the beginning of COVID, and we will continue to do so until it's over. That concludes my report. I'm here to answer any questions, and I would request that you receive and file.
Thank you. Are there any members of the public that would like to make comment about the report? Hearing none, are there any members?
Dr. Lang. Oh, sorry.
Dr. Lang, go ahead.
Too soon.
Go ahead, Dr.
I just wanted to echo what Jeff said. The EMS division has been working 24/7 along with the public health department in supporting the healthcare system, the first responders, EMS, fire departments, law enforcement, everybody in the county, and specifically to support the citizens and visitors of Kern County through this pandemic. And I want to also thank all the first responders that are dedicating themselves to taking care of everybody during this crisis. As somebody that is working clinically and seeing this on a day-to-day basis, this is extremely stressful. I know firsthand, and I feel it too, and I want to thank everybody for what they're doing and doing their part. And also want to make sure we communicate, like John said, that there is support out there if anybody needs it. So thank you, everybody.
Thank you, Dr. Lyon. Would anybody else like to comment? I alluded to this a moment ago, but there are some statewide meetings that are occurring with county health officers, hospital administrations, fire departments, many, many different layers of government, skilled nursing facilities. It's all over the state. There are meetings that are taking place where people are meeting with to find out what best practices are. It is extraordinary that the people that serve us in emergency medical services, the health department, our hospitals, throughout the system in Kern County, I'm not just blowing smoke here. It is remarkable how often Kern County is just light years ahead of other places. And I cannot tell you the gratitude I have for the dedication and creativity and nimbleness and just dogged perseverance of people here to get these things done, because it has saved lives. As tragic as this circumstance is, it would be worse, way worse, if extraordinary people weren't performing extraordinarily here. So I want to echo what Dr. Lyon said about thanking all those that are on the front lines doing this. Everybody down to the little lady that's pulling blood out of somebody's arm, breathing the air that the person in the bed is exhaling. This is a dangerous, unprecedented thing, and I'm just so proud of the people in Kern County that are helping do it. So I hope that we can convey that every time we have a chance. But thank you for your report, Mr. Ferris, and your comments, Dr. Lyon. Okay. Any other comments about the Jeff's manager's report? Okay. Then a receive and file would be in order. Is there a motion to receive and file?
This is Dr. Lyon. So moved.
Thank you. Is there a second?
This is Earl Canson, second.
Thank you. Would all in favor of that receive and file please say aye?
Aye.
Aye.
Is anybody opposed? I heard all ayes, nobody opposed. By the way, for the record, Orchel Cryer supported our establishment of the hearing for item 10H a moment ago. So I'm not sure if he'll be on record for this, but if we get that, we'll put Orchel's vote on the receiving file as well. Mr. Ferris, miscellaneous documents for information, item number 12. I believe there are none to receive today. Is that correct?
That's correct.
Thank you. Are there any members of the board, item number 13, that would like to make an announcement or give us a report on something that we should know about that you have a perspective on? This is to our members of the MCAB board. I don't hear anyone. Okay, any staff need to tell us anything before we move forward? Okay, thank you guys for your willingness to do this via Teams. It's a new world for all of us, but it seems to be working pretty well, so I appreciate you guys and your patience with this. We have announcements under item number 14. The next regularly scheduled meeting is Thursday, November the 12th, 4 p.m., to be held in the same Teams format or virtual format. The deadline for submitting public requests for information on that agenda would be Thursday, October 29th at 5 p.m. You can submit that to Kern County EMS Program Manager Jeff Ferris if you have something for that. And if there's nothing else I want to give one more chance. Anything else we need to deal with today? Then I would like to adjourn today's meeting in honor of Captain Pete Hine. Pete Hine is a retired CAL FIRE captain who was working at the field headquarters for the Stagecoach Fire, and he unfortunately passed away while on duty there on Tuesday, August 11, of an acute medical emergency of some sort. I don't know what that was. But although none of us probably knew him directly, he is a part of the emergency service family in the larger extent, and I thought it would be appropriate for us to adjourn the meeting today in honor of Captain Pete Hine. So with that being said, is there a motion that we adjourn?
So moved, Bruce.
Thank you, Bruce. Without objection, so ordered. Thank you, everyone. Please stay safe, and I'm so grateful for your willingness to help us work through these tough issues. Bye-bye.
Thank you.